Starting with the hypothalamus. So now talking more about endocrine organs. So the hypothalamus, again, is part of the brain. So it is the nervous system and the endocrine system. So they're both. So again, it's a neuroendocrine gland or neuroendocrine system. So nervous system, endocrine. The hypothalamus itself is going to make two hormones that are moved into and released by the posterior pituitary. Now, the posterior pituitary stores them. And then when stimulated, the posterior pituitary will release them. So the posterior pituitary is going to store and release antidiuretic hormone and oxytocin. We'll talk about the effects of both of those later on. So antidiuretic, I call it the anti-pee, meaning anti-urination. So if you have to pee, this is going to stop you from peeing. And oxytocin is involved in many, many things, but we're going to talk about it in the sense of lactation, so producing breast milk and labor. It also secretes, so the hypothalamus, this is just in the posterior pituitary, these two that are stored and released, but they're made by the hypothalamus. These are made by the hypothalamus and released by the hypothalamus that control the anterior pituitary. So we have a posterior part of the pituitary gland and an anterior part just based on directions. So again, the hypothalamus is going to release hormones in the hormonal response or hormonal stimuli, where the hypothalamus releases a hormone that has a direct effect on the anterior pituitary to release more hormones. So this is going to be a lot of releasing hormones is what we call for the hypothalamus. So you're going to see releasing hormones coming from them. So thyroid releasing hormone is going to be one of them. And it goes to the anterior pituitary, and the anterior pituitary releases thyroid stimulating hormone. So, and then goes to the thyroid and has it release its T4 and T3. We'll talk about that more later. But so it's going to be releasing hormones. And then goes to the anterior pituitary, it releases its hormones, and usually from the anterior pituitary, it goes to the next organ, so the adrenal glands, the pancreas, things like that, reproductive. The hypothalamus also has a kind of direct connection. So the autonomic nervous system is a direct connection to the internal part of the adrenal gland or the adrenal medulla. So we're going to see the adrenal glands come up later, where they have a cortex, and we're going to talk about the different layers and what hormones those layers release. And then it has an inner middle or medulla. The hypothalamus has a direct connection nervous system wise through the sympathetic nervous system to cause the adrenal medulla to release catecholamines, which are going to be part of the sympathetic nervous system. So again, catecholamines of norepi and epinephrine. So again, most often the hypothalamus is going to release releasing hormones, but they can release inhibiting hormones. So it can either increase the response or it can decrease the response. So releasing hormones is going to release. So it's going to be stimulating the production or synthesis and the secretion in the anterior pituitary. So you are going to cause the anterior pituitary to release more hormones to, again, go to the thyroid, the adrenal gland, going all over, which we'll talk about specifically later. Inhibiting hormones are going to stop. So they're going to stop the synthesis and secretion of the anterior pituitary. So this is going to come back to negative feedbacks. Say, again, you have low thyroid hormone. I'm going to talk about this again. So you have low T4. Well, then your hypothalamus is going to release TRH, which is thyroid releasing hormone, go to the anterior pituitary and causing it to release thyroid stimulating hormone that goes to the thyroid to release more T4. So you increase it again, get it back to its normal range. For whatever reason, say you're taking something or meds or something's increasing where you have a high level of T4, it's higher than what you want it to be. The hypothalamus is going to kind of stop all of this. So it's going to stop producing the releasing hormone, and then it'll stop doing the TSH. So you have kind of a lot of the negative feedback. If you constantly are having high levels and it wants to do inhibitory hormones, then it'll stop it. But more often we hear about releasing hormones when we talk about the hypothalamus. The hypothalamus is directly connected to the pituitary gland. And saw this in A&P lab in A&P1 by the infundibulum. So you have the hypothalamus in this section here, and you have the infundibulums here, and then this is the pituitary. This is going to be the anterior pituitary. This is going to be the posterior pituitary. Posterior pituitary, again, is going to have more of a neurologic connection where oxytocin and ADH are going to be released and stored by the posterior pituitary and released there. The communication between the hypothalamus and the anterior pituitary is going to be through those hormones. Just a different connection. So there's blood connection in the infundibulum to the anterior pituitary, and then there's nerve axon connections between the posterior pituitary and the hypothalamus. And then this is showing you the direct connection with the hypothalamus to the adrenal medulla, or the middle of the adrenal gland. And it's going to be the release of those catecholamines, norepinephrine and epinephrine. So again, said it a couple of times, the hypothalamus is a neuroendocrine gland, meaning it's part of the nervous system. Talked about it when the brain, and it's also part of releasing hormones. So it's part of our endocrine system. And again, it's a link. So we have the nervous system can help control your hormones, and your hormones can help control your nervous system. So they work together. They're the communication systems of your body. So they like to communicate with each other and keep in track. So everything's going okay. Again, the pituitary is the anterior and the posterior. So this is just looking at that picture a little larger. So again, hypothalamus, you have the infundibulum here, nervous system connection to your posterior pituitary, stores ADH and oxytocin and releases. You have blood circulation that communicates with the anterior pituitary. So hormones are going to travel from the hypothalamus down into the anterior pituitary. And then the anterior pituitary is going to release more hormones. So you have the hormone kind of stimulation. And then remember, there's the direct connection through the autonomic nervous system, specifically going to be your sympathetic. Direct connection down into the adrenal medulla, so the middle part of the adrenal gland, and that's going to release epinephrine and norepinephrine. So this is going to be for your fight or flight. So posterior pituitary, again, is going to be more of the neural tissue. So it's going to be neural hormones because it's going to release ADH and oxytocin that's made by the hypothalamus. So that's why we say it's kind of neural hormones, is because it's made by the hypothalamus, nervous tissue. Again, communication between the nervous system and the hormones and the endocrine system. Anterior pituitary is just a gland, so this is going to produce the hormone. So it's going to be an endocrine gland. So posterior pituitary, the axon terminals are the ends of the axons of the neurons from the hypothalamus produce those two hormones that we mentioned. Oxytocin and antidiuretic hormone. We also kind of transport these productions of the neurons in the hypothalamus produce the hormones, and they can be transported through a portal system. So remember, portal system goes through two capillary beds. So it's going to go through the capillary bed of the hypothalamus and then the capillary bed of the posterior pituitary. So it's going to be the portal system. And when we say hypo is hypothalamus, physeal is more going to be our pituitary gland. So oxytocin and ADH are released by the posterior pituitary. Looking at oxytocin. Oxytocin has a lot of different kind of reactions that happen. It does also work as a neurotransmitter as well. So remember, a lot of these hormones like epinephrine and norepinephrine can act as a neurotransmitter. Dopamine's another one. So it can work as a neurotransmitter if it's going in the synapses, neurons. If it goes into the bloodstream and going to target cells, then it's going to work as a hormone. And so we're just talking about oxytocin. Mainly, this is oxytocin in females. So if you want oxytocin around, it's going to be for contractions of the uterus, for labor, during childbirth. So this is going to be, you've heard about a Pitocin drip. It's a relative or an analog of oxytocin. So you want to stimulate uterine contractions, you're going to give oxytocin. Contractions are smooth muscle in the wall of the uterus in the myometrium. So it's going to increase the contraction of that smooth muscle in the wall of the uterus and increase it. This again, oxytocin in the fact of labor is going to be an example of a positive feedback, because once you start oxytocin with childbirth, labor, you have oxytocin around. Well, the uterus is going to start contracting. Well, you want more oxytocin. You don't want to go back to normal. You want to increase the effect. So you want to have stronger and stronger smooth muscle contraction of the uterus, because that's what's going to eventually push the fetus out, the baby out. So you want to increase oxytocin and increase and have an exaggerated effect. So again, positive feedback, oxytocin is one example. Oxytocin is also involved with milk ejection. So what happens, and we're going to talk about another hormone called prolactin. So the milk is made by prolactin. But to actually get it to the point where it can go out the nipple to the baby to feed, then it needs oxytocin around. So milk ejection is oxytocin. Making milk is going to be prolactin. So oxytocin and prolactin are going to be needed to kind of for lactation, but for just ejecting the milk is just oxytocin. Antidiuretic hormone. So again, I mentioned this in a little bit ago, but I call it the anti-P. So the anti-urination hormone. So this is going to decrease the amount of urine you're producing. So the hypothalamus is going to contain osmoreceptors, which are going to look at the solute concentrations of your blood. So, looking at the solute concentrations also monitors water. If your solute concentration increases, that means your water level is decreasing. So, if you're having too little water, well, then you don't want to lose it. So, you don't want to make urine. So, if your solute concentration is too high, remember this is going to be released by the posterior pituitary. Well, where is urine made? In the kidneys. So we're going to talk about the antidiuretic hormone again when we get to the kidneys as well. But knowing the basics of it in the beginning is good. So target the kidney tubules. What they're going to do is reabsorb or take in, maintain as much water as they can. So they're going to prevent urination. So prevent urine formation, anti-P. So kidney tubules, normally without ADH, water might be lost um, through urination. With the antidiuretic hormone, water is brought back into the bloodstream. And that's where we say reabsorption happens. So you're not going to urinate it out. You're going to reabsorb it and take it back into your bloodstream. Well, less water going into the urine is going to be a lower volume or less amount of urine. So just think about it. If you haven't drank water in a while and you are actually getting kind of dehydrated, well, your kidneys are going to work as much as they can to make sure that you reabsorb and keep as much water as possible. Well, you're not going to pee. You don't go to the bathroom as often. When we get to really high concentrations of antidiuretic hormones, so this is going to go to severe dehydration levels. So you're getting to the point where you're really need to drink some water, and you need um, to make sure that you're keeping what little water you have left because you're getting into desperation mode. High concentration can cause vasoconstriction. Now, looking at why this happens. If you have low water, again, in your blood, what's a lot of plasma? Water. So, less water means less blood flow because you just don't have enough. You have less, or blood, I should say, more blood volume. So, you have decreased blood volume. It's as if you kind of are bleeding even though you're not bleeding. So, you have less blood volume because you have less water. Well, less blood volume, you want to maintain your blood pressure. Without the blood volume, it actually decreases your blood pressure because volume helps maintain the pressure. If you only have, say, you have a pipe and you have this much water, well, it's not pushing a lot against the sides and the walls of the vessel. Versus if you have this vessel, the same amount, and you have this much volume. Well, exerting more pressure against the walls of the vessel. So that's going to be blood pressure. Less blood volume, less blood pressure. More blood volume, more blood pressure. Well, if you're in decreasing your blood pressure because you don't have enough blood volume, well, how do we increase our total peripheral resistance? We're going to decrease our diameter of our blood vessel. So again, if we just have a low amount, well, this may put more pressure on the sides of the wall versus having a larger blood vessel. So this is going to help maintain blood pressure in kind of the face of dehydration. Another thing, again, high levels is going to decrease water loss through sweating because you're trying to keep as much water inside your body because of dehydration risk. Antidiuretic hormone, the release of it is actually stopped or inhibited by alcohol. So if you are drinking alcohol for whatever reason, then all of a sudden you notice that you have to actually pee more often and you get a hangover, which is majorly going to be side effects of dehydration. This is because you're not having antidiuretic hormone around. So you need antidiuretic hormone to help prevent the dehydration that's happening, but alcohol is stopping your antidiuretic hormone and it's making you pee out all your water. Not all your water, but a good amount where you get dehydrated, and that means hangover.